Hey guys, so today I'm just going to quickly go through briefly the DOHNS OSCE examination, just quickly look at what it entails in the United Kingdom. So the DOHNS OSCE Part B examination is an examination that must be completed to practice at the level of a registrar in the United Kingdom. It's combined with the MRCS Part A to form the MRCS ENT. From 2021, I believe the DOHNS Part A examination has essentially been halted. That's for a number of reasons, and I think they cited the usefulness of the examination as well. So even if you have the DOHNS Part A and you've completed the DOHNS Part B, you do obtain the DOHNS, but you would need to complete the MRCS Part A as well. And now I think they've sort of streamlined it, so you just need to do the MRCS Part A and the DOHNS Part B in order to obtain MRCS ENT to work at the level of a registrar in the United Kingdom. So what does the DOHNS OSCE Part B contain? Well, briefly, it contains two parts of the examination. There's the manned stations and then the unmanned stations. In terms of the unmanned stations, there's 20 to 25 stations. That may vary, so please do look at the instructions sent to you by the examination hall. Each station has on average 5 questions, and they're of the SBA short based answer type questions. So what they want essentially is 3 to 4 words, maybe a sentence, short and sharp, directly answering the question. And those answers are typically recorded if it's in person, written. If it's not in person, it will be in an online format. In terms of the manned stations, there's roughly 4 to 5. Again, that may vary. Reading time before each station, and the stations usually cover taking an ear, nose, and throat history, consenting for the various ENT procedures such as laryngoplasty, grommet insertions, tonsillectomies, the risks and the benefits you need to state as well during those stations. The explanation station, so explaining various conditions, for instance, cholesteatoma. Examination stations, so an ear, nose, and throat, head and neck examination, dizziness examination, and the nasal endoscopy examination can come up as well. Majority of these cases, you have an examiner in the room and typically a patient as well within the room, and you're assessed on a number of aspects, including the way you communicate with the patient, the examiner, when answering the questions, your demeanor, your ability to respond to the patient, your ability to show empathy. These are all characteristics of a good UK trainee, so it's some skills that you have to sort of demonstrate and show, and I think that is the difference between an international person sitting the exam and someone from the UK. So this is typically an area of focus for international trainees and surgeons. Just briefly, in terms of ENT training in the UK, well, typically it's ST1 to ST8 training, so 8 years of training until consultancy. At the level of ST3, you're considered a registrar. Now, typically if you're coming from abroad, the two aspects of which you try and focus on is either obtain a training number if you can, although those are generally quite challenging to do so, but it is possible. And the other option is obviously to obtain a trust grade post, and that can either be at the level of an SHO or the level of a registrar. It really depends on your experience and the hospital and the departmental need. There is an option to stick with being a trust grade registrar and then develop all the attributes and demonstrate the skill level to obtain a consultancy post. I've been told that that's a bit more difficult, but I've also been told that that can be done, so if that's something you can consider. In terms of tips for the examination, it's all about practice, practice, practice. Achieve your MRCS ENT as soon as you can. If you're coming from abroad, it may be worth trying to obtain that trust grade post and then try to look for applying for a training post thereafter. And if not, you can always try to see if you can progress as a trust grade registrar. My final bit of advice would be please to sign up to the mock OSCE that's delivered by UK trainees. The link will be in the description below. It runs every month. It's quite useful, and previous candidates have found it quite useful, particularly the manned stations in which you'll have a one-on-one faculty to trainee ratio for those stations and feedback thereafter. Great, we'll see you there.